On this Wednesday night, Alberta's fast-paced plan to reopen.
It means the best Alberta summer ever.
The details, the backlash, and the impact on the greatest outdoor show on earth. Pandemic response failures. The Auditor General on how Ottawa dropped the ball. While the British Prime Minister's former advisor delivers a scathing review of the UK pandemic plan.
This is like a scene from Independence Day with Jeff Goldblum saying the aliens are here and your whole plan is broken.
Going with the grain.
It's becoming a really sexy proposition for many farmers.
Oat milk's rise to the cream of the crop of dairy alternatives. And to the moon, Canada's plan for lunar exploration.
Global National with Donna Friesen.
Good evening and thanks for joining us. Another province has laid out plans for easing COVID-19 restrictions. Alberta, which only a few weeks ago had Canada's highest number of active infections, now has the fastest reopening plan in the country. Premier Jason Kenney says if enough people get vaccinated, all restrictions could be lifted by early July, just in time for the Calgary Stampede.
Today, we are truly near the end of this thing. We're leaving the darkest days of the pandemic behind and stepping into the warm light of summer.
Like other provincial reopening plans, Alberta's three-step strategy is linked to vaccinations. Premier Kenney calls his approach cautious, but he's already getting pushback from others who fear it's too much, too fast. Heather Yourex-West has the details and the reaction in our top story tonight.
It was 1 week ago that Alberta Health Services warned intensive care units in the province were busier than they've ever been. Alberta's third wave hit hard. But with cases now beginning to fall, the province is looking aggressively towards opening back up.
In short, it means that finally getting back to normal, and I think it means the best Alberta summer ever.
Part of those summer plans include the Calgary Stampede. While other cities have already cancelled events like Toronto's CNE, there are plans to hold a rodeo and midway here in just over a month's time.
Conklin is coming, as I understand it, for the Midway. The Cowboys are coming for the rodeo. I'm sure the young Canadians and all of the local performers are geared up.
Alberta is betting on a single-dose summer being enough to get the province back to normal in a hurry. On June 1st, people can gather in groups of up to 10 outdoors. Patios and hair salons can reopen, and outdoor sports and performances with up to 10 people can resume. 2 weeks after 60% have one dose, outdoor social gathering limits move to 20 people. Indoor dining resumes. Gyms, movie theaters, youth sports and day camps open. And large events like concerts and festivals will also be permitted with up to 150 people. After 70% of Albertans are vaccinated, projected for early July, all further restrictions will be lifted. Alberta's former chief medical health officer worries it's too much, too soon.
Yes, it's setting it up for a fourth wave. The science is pretty clear that the new Indian variant will be 1.617 in people who've only had a single dose is quite good at infecting them again. You really need 2 doses to get good protection.
This does not look like an evidence-based plan. It looks like the Premier is working backwards from the Stampede.
There won't be a parade kicking off the Stampede. The Premier says the City of Calgary won't be issuing a permit for that. But after 15 months of restrictions, the rides and rodeo are a go. Whether that kicks off the best summer ever, we will see. Heather Yourex-West, Global News, Calgary.
In Manitoba, hospitals are still scrambling to keep up with all the people becoming critically ill with COVID-19. 23 Manitobans have already been airlifted to hospitals in Ontario. More are expected to be transferred later today. And as a sign of just how sick these patients are, the province says one person who was about to be transferred to Ontario earlier this week died before takeoff. Newfoundland and Labrador has confirmed a growing cluster of COVID cases there is caused by the B.1.617.2 variant. That's the one first detected in India. There are now 46 active cases in central Newfoundland, and much of that region is in partial lockdown.
This variant is more easily transmissible than the original strain of COVID, and reports have also indicated it may be more transmissible than B.1.1.7.
Dr. Janice Fitzgerald says confirmation of the variant won't alter that province's vaccine rollout. 55% of the eligible population has received at least one vaccine dose. The decline in case numbers in Ontario has given hope for a return to in-classroom learning before school's out for the summer. While some parents want their children to have the opportunity to go back, others believe it only makes sense to keep them home to avoid any new outbreaks. As Eric Sorensen explains, with just weeks left in this school year, it's crunch time for the Ontario government to come up with a plan.
This is a pivotal moment for Rebecca Steinhoff's children and 2 million Ontario students from kindergarten to grade 12. Will they go back to classrooms before the school year is out or not? They've been learning from home since April 19th. Rebecca wants her 3 school-aged kids back in the classroom as soon as possible.
My kids are really just missing their friends, missing school. They're disengaging from online learning. I think they need that kind of closure that going back would give them.
It's a race against time to get COVID numbers down enough to reopen the schools before they close again for the summer. Ontario's Chief Medical Officer of Health is pushing for it.
I've been encouraging schools to open as soon as possible.
Most Ontario health districts now have very low rates of COVID. Even the 2 Ontario regions inundated with cases, Toronto and Peel, have seen case numbers drop by 2/3 in the last 3 weeks.
Schools should be the last to close and the first to open.
Other parents, though, prefer to keep their children learning from home. Kyla Harrington works from home, so it's convenient, and she thinks it's safer in a pandemic.
My instinct was to keep my kids home. I went straight to safety. I knew my son with asthma. My kids are grade 3, grade 6, and grade 8, so they're more independent, and so they can handle the responsibility.
Some doctors believe kids should not be hurried back into classrooms when COVID variants can still spread easily.
Will there be outbreaks? Yeah, I'm sure there will be outbreaks. And so to have a child go back to school and only to have that school close again, I think that's very hard.
We have some differing opinions.
Ontario's premier is being pressed to make a decision as early as this week. Schools can reopen with care, says this infectious disease specialist.
And that really does mean, lower class sizes, open windows, a lot more outdoor use of classrooms. If you can make an achievable plan based on that, I think it's reasonable.
Some parents feel so much was lost in the last year that their children should be allowed to repeat their year. Shanice Jackson's child has special needs.
She doesn't really feel like she's learning the way that she should be learning, trying to repeat grade 6. She's ready to, she wants to.
But there can also be adverse effects from youngsters separating from their familiar cohorts. There are no easy answers.
My kids, ask me every day, are we going to go back? Are we going to see our friends for the last month of school?
Rebecca Steinhoff wants her kids back in school, but also just wants a decision to be made. Eric Sorensen, Global News, Toronto.
Some good news about vaccines among Canada's Indigenous population. Indigenous Services Minister Mark Miller says 75% of adults in First Nations, Métis and Inuit communities have now received at least one dose. In Canada's non-Indigenous population, 53% of people have had one dose. Since the vaccine rollout ramped up in January, active case numbers in First Nations communities have dropped by more than 85%. As of yesterday, the federal government was aware of 741 active cases in First Nations communities on reserves. The federal government is getting just a passing grade for its handling of the personal protective equipment issue in the first weeks of the pandemic. Canada's Auditor General says when the pressure mounted, the government quickly acquired $7 billion worth of desperately needed PPE and medical devices. But as David Aiken reports, it failed to address long-standing issues with the national stockpile of PPE.
The first wave of the pandemic last spring was quickly followed by a frantic hunt for shields, masks, gowns, and other personal protective equipment, or PPE.
There is insufficient number of ventilators and an inadequate supply of personal protective equipment across the country.
There is a definite, lack of supply of being able to get things like masks, gloves, other things like that.
But then, after what the Auditor General on Wednesday called an unprecedented government response to the crisis, millions of pieces of PPE started to ship to frontline workers.
What we did see was that the government was quite reactive and flexible. And we did see Health Canada and the Public Health Agency, as well as Public Service and Procurement Canada, come together and collaborate.
Still, Canada would not have had to scramble the way it did if the federal government had maintained its reserve of PPE and medicine.
We found that before the pandemic, the Public Health Agency of Canada had not addressed long-standing known issues with the systems and practices used to manage the National Emergency Strategic Stockpile.
And those issues still have not been addressed today. In the meantime, the government's focus has been on building more domestic capacity to manufacture PPE. Indeed, just today alone, Ottawa handed out about $7 million to manufacturers in Alberta, Ontario, and Quebec, all aimed at developing and building the next generation of PPE and medical devices. Donna?
All right, David Aiken in Ottawa, thanks.
Tens of thousands of people died who didn't need to die. When the public needed us most, the government failed. And I'd like to say to all the families of those who died unnecessarily, how sorry I am for the mistakes that were made and for my own mistakes at that.
That is Dominic Cummings, the former top advisor to British Prime Minister Boris Johnson. He has turned on his former boss, who he now calls unfit for the job. He says Johnson's handling of the pandemic has been chaotic. He accuses Johnson of making constant U-turns, like a shopping trolley smashing from one side of the aisle to the other. Crystal Gamansing on the scathing testimony from the man who helped get Boris Johnson elected.
The truth is that senior ministers, senior officials, senior advisors like me fell disastrously short.
Unfiltered, unpopular, and before a Commons committee, Dominic Cummings was unwavering in his condemnation of the UK government's response to the pandemic.
It's completely crackers that someone like me should have been in there, just the same as it's crackers that Boris Johnson was in there.
Cummings had no choice but to paint himself with the same critical brush. Until late 2020, he was in the government's inner circle, helping to craft the UK's COVID-19 strategy. Cummings told MPs the health secretary should have been fired on multiple occasions and that Prime Minister Boris Johnson didn't grasp the gravity of the pandemic.
There's a great misunderstanding people have that because it nearly killed him, therefore he must have taken it seriously.
While Cummings outlined the failings of the government, his former boss was facing questions in Parliament.
I don't think anybody could credibly accuse this government of being complacent about the threat that this virus posed at any point. We have worked flat out, Mr. Speaker.
But more questions are being raised and more evidence will be given as Parliament's Health, Sciences and Technology committees investigate Britain's pandemic response. More than 127,000 people have died from COVID-19 so far. An independent inquiry into the government's handling of the crisis begins next year. Crystal Gamansing, Global News, London.
India now hit by a cyclone. Coming up, the natural disaster happening on top of the COVID disaster. Plus, a sight not seen in 3,000 years. This is the last thing India needs right now. Cyclone Yas slammed into the country's east coast this morning. More than 1 million people were forced to flee their homes. A huge tidal surge has turned roads into rivers and homes to rubble. At least 6 people are known to have died in the storm. Police in Italy have arrested 3 people after that cable car plunged to the ground and killed 14 people. Officers say a clamp was used to intentionally deactivate the emergency brake on the cable car. It failed to engage when the main cable snapped. The cable car plunged to the ground and rolled down a steep hill. Prosecutors believe the move was a stopgap measure to avoid shutting down the attraction for extensive repairs. Criminal charges are being considered. A 5-year-old boy is the only survivor. He is recovering in the hospital. For the first time in 3,000 years, Tasmanian devils are officially back and breeding on mainland Australia. 7 tiny joeys were born at this wildlife sanctuary near Sydney. The team from Aussie Ark has been working for 10 years to reintroduce the endangered marsupial to the mainland. They died out on mainland Australia after the arrival of dingoes. The struggle to answer one of the biggest questions of the pandemic. Still ahead, where did COVID come from? There is still no certainty about the origins of the novel coronavirus, and now the theory that it may have been an accidental leak from a lab in Wuhan, China, is gaining traction. U.S. President Joe Biden has ordered an intelligence review of the possible scenarios. Jackson Prosco explains what's triggered this and why it's so important to find the answer.
That's it.
1 year later, there are treatments and vaccines, but the most perplexing question of the pandemic remains unanswered. Where did the virus come from?
We've lost almost 600,000 Americans to COVID-19, and we have to get a better sense of the origin of COVID-19.
There are two competing theories, both centered in Wuhan, China. Either that the virus crossed over from infected animals to humans, or that it escaped from a high-level lab in the city by accident.
Many of us feel that it is more likely that this is a natural occurrence. Because we don't know 100% what the origin is, it's imperative that we look and we do an investigation.
The lab leak theory gained steam after a U.S. intelligence report claimed 3 researchers from the Wuhan lab were treated in hospital for COVID-like symptoms in November 2019, a month before the first reported cases of the virus. China has denied the possibility. State media calls it a conspiracy theory.
Nobody knows because we don't have the data. We haven't had the kind of investigation that we need to really understand it.
The Biden administration has ordered a detailed intelligence report in the next 90 days, while the U.S. wants the World Health Organization to launch a second independent investigation, accusing China of not being fully transparent.
And give international experts the independence to fully assess the source of the virus and the early days of the outbreak.
Yet Biden's team is wary of comparisons to the Trump administration, which pushed the lab theory and allowed conspiracy theories to flourish.
And there is significant evidence that this came from the laboratory.
Scientists say it's not about laying blame, but answers are important.
It's about the origin of this virus and being able to prevent future pandemics before they start.
That could help contain future outbreaks or prevent future mistakes. It won't bring back all that's been lost or stop the virus that's still raging around the world. Jackson Prosco, Global News, Washington.
Got grain? Next, the growing demand for milk alternatives. The Duke and Duchess of Cambridge have gone back to their university days in Scotland. They went head-to-head in a land yachting race at St. Andrews, where they met and fell in love 20 years ago. The royal couple raced in wind-powered go-karts organized by a charity that helps teenagers who care for family members. At one point, Kate's back wheel was lifted up by the force of the wind, and Prince William, well, he claimed he won. There are all kinds of options these days if you don't or can't drink cow's milk. There's milk made from soy, from almonds, and from oats. Oat milk has actually been around for decades, but now it's really taken off and become a multi-billion-dollar product. Mike Drolet explains why oat milk is booming.
Wow, no cow. Oat milk marketing has targeted a certain demographic.
It's for the next gen, my gen.
More specifically, Gen Z and millennials. And those generations are not only listening, they've made oat milk the health fad of the year. Oatly, the Swedish-based company that made milking an oat cool, went public last week with a valuation of $10 billion US. Numbers like that don't mean much in coffee shops. Here at Toronto's Wallace Espresso, it's all about taste.
They steam up really closely to the way dairy does.
Daniel Wallen says his oat milk orders have risen sharply over the past 3 years and now eclipse soy and almond as the alternative of choice.
But the other thing with oat milk is because I feel it's so close to dairy milk in flavor and texture, it's reached a broader audience.
It's the same audience that fed into the plant-based burger boom of 2019. Health is an issue for them, but so too is the environment. And oat milk uses far less land and has fewer greenhouse gas emissions than dairy. It also takes 628 liters of water to produce 1 liter of milk, compared with 371 liters for a liter of almond milk and 48 liters for oat milk.
I think it's a great alternative right now until something else comes along. We've had all sorts of milks that haven't really stuck, but if you think about hemp milk, it does not taste good. So if there's a product on the market that tastes good, you can put it in your coffee, you can put it on your cereal, and it doesn't feel like you're hard done by, then I think it's more likely to stick.
Oat milk certainly checks all those boxes, and that's bringing smiles to Canadian farmers who produce more oats than anywhere outside the European Union.
Oat is certainly growing. It was really kind of the forgotten child in the prairies for a very long time, but now it's becoming a really sexy proposition for many farmers.
Sexy? Oats? Why not? Mike Drilla, Global News, Toronto.
Some exciting plans for lunar exploration were revealed today. The Canadian government has put out a request for proposals to build a robotic vehicle that could end up on the moon.
Within the next 5 years, Canada plans to land a lunar rover on the moon. That's the big news today. To achieve that objective, the Canadian Space Agency will be looking for 2 Canadian companies to develop concepts for the rover and science instruments for the mission.
It will have to make it through the extreme cold and dark of a lunar night, which lasts about 2 weeks. Just the job for Canada, right? There was just another rare lunar event that required less expertise. It's called the Super Flower Blood Moon, and it was the only total lunar eclipse in 2021. It was visible on the west coast in the early morning hours. It's a supermoon because it's full when it's at its closest point to the Earth. The blood is from the red color that's the result of the lunar eclipse, and the flower is what a full moon is called in May. That's Global National for this Wednesday. I'm Donna Friesen. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.